Go further. Alpha adrenoblockers, very interesting drugs. So we remember about alpha-1 receptors. Yes, the most important location of alpha-1 receptors in the blood vessel. In the blood vessel. So if we block the alpha receptors in the blood vessels, so we have less effect of the neurotransmitter on the receptor on the blood vessel, and the blood vessel will dilate. Yes, it will relax. So the drugs prazosin, doxazine, terazazine, phentolamine, and nicergolin, they block alpha receptors. But these drugs, prazosin, doxazine, terazazine, they are selective. Remember, what is it selective? Selective, it means they block only one type of receptor, exactly alpha 1. Exactly alpha 1. The phentolamine and nicergolin, they are non-selective. They block alpha 2 and alpha 1. Non-selective. Block 1 and 2. Oh, non-selective block 1 and 2. Okay, so talking about this, we would say that which drugs are actually better. Okay, how to say it? The prazosin, doxazine, and terazazine, these drugs are longer acting, but they are not seriously used in treatment of hypertension. They are more used in the treatment of prostate adenoma. Okay, it may sound like surprisingly, but yes, this is truth. We use them for the treatment of prostate adenoma because they also reduce the contraction of the urethra for the men who suffer from prostate adenoma and they feel pain during urination. So to relax these smooth muscles, we use the alpha-1 adrenoblockers, prazosin, doxazine, terazazine. So this is a very good use for this drug. The drugs of the second group, which are non-selective, phentolamine and nicergolin, they have more effect, like blood vessel relaxing, but the effect is very short. What is a short effect? Short effect, short. Okay, why the effect is very short? Because they are non-selective. And as we remember, I will show you on this picture. So in this part, we have alpha-2 receptor, alpha-1 receptor in the postsynaptic. And if this postsynaptic cell would be the blood vessel, that smooth muscle of blood vessel. So we are saying that alpha adrenergic blockers, they will block this receptor, alpha-1, and reduce the effect of adrenaline on this vessel. So the vessel will relax. Okay, this is a good effect, yes? So here we get relaxation. But on the same time, phentolamine can block alpha-2 receptors, these presynaptic, remember them, yes? So if we block these receptors, we will have no inhibition of the release of noradrenaline. You see, the function of this receptor is to block release of noradrenaline. But if you stop the effect of this receptor, they will not block, okay, will be no block, and it will be only stimulation of the release of noradrenaline. So noradrenaline will release in greater amounts, and this greater amount will again stimulate this alpha-1 receptor, and the blood vessel will again contract. Okay, I hope this was clear. If not, just watch my explanation once again. Okay, thank you. I will erase this part and we will go further. This was about alpha adrenoblockers.